now we're going to move into physical exam with Maria Taboni, one of my colleagues in internal medicine. I'll let her further introduce herself.
Thank you very much, Jill. Well, I'm an internist, a colleague of Jill, as she said, and even before COVID, I really got on board with telehealth and virtual medicine. And I was fortunate enough before COVID, hit us to do 2 courses virtual at the Jefferson University. And now I'm officially a telehealth facilitator, which is that individual that is the interface between IT and your patients. And fortunately, when we saw the worst of COVID, and I'm very involved with the bariatric clinic at St. Joe's, we were very able to switch most of our encounters to virtual. And we were basically the only clinic in Ontario that was able to keep up with absolutely everything. So I'm gonna share my screen. Give me just 1 second here. Perfect. And I think that it's some of the things that I'm going to be mentioning at the beginning, we already heard. And so I think we are very aware now of what are the pros of doing virtual encounters and virtual physical exams. Very convenient for the patients in terms of times and cost saves, and making care for them definitely more accessible. And I do believe very strongly that also is very convenient for physicians. You have now the opportunity to have an encounter and do a physical exam, not in your office, but seeing into the world of the patient at home if they are at home. Definitely, we all know, well, the science is telling us that increases patient satisfaction, and also for the physicians there are other advantages of virtual care, less office stay and wear, and we are seeing at the clinic, and that's what everybody is finding, that there's actually much less no-shows. When we have to teach our learners, junior or more senior learners, of these virtual encounters and the physical exam, first we have to understand ourselves what are the limitations, and there's very limited data on the validity of a virtual physical exam, and we know that there's a tremendous amount of limitations that we could encounter as we do our encounters and physical exams. From technical, the signal is not good, you lose the patient where the vision is on Zoom. The physical exams, virtual physical exams, they have the potential for being incomplete, in the sense that we cannot do auscultation, we cannot do palpation. And if you have a particular situation where you in your office, for example, you will do a special maneuver, well, sometimes, very challenging, you won't be able to do that when you see a patient through a camera. I think that it's very important to know that the physical exam, the virtual physical exam, is actually new for all of us. So we don't have JAMA rational clinical virtual exams to tell us what we can do and has been validated, but it's the experience of all of us that have been doing quite a few assessments that what is actually bringing these virtual physical exams forward. It's important to understand that this is a new field, and patients and physicians, we are not all of us are very savvy on what can be done or not be done. So when we teach our learners, we have to make sure that we understand the limitations ourselves first. I'm not going to go over these 2 next slides in detail, but I always tell the learners when they join me for a preoperative virtual exam that they have to keep in mind that these encounters, although they are virtual, they should be and remain very professional. So we should be dressing properly, using very proper professional language, and especially when we're engaging with a patient, I think that the website manners are different from your usual bedside or when you are in the office. And we as physicians, in order to teach our learners, we have to understand those very well. It's important when the residents join me on virtual physical exams, it's interesting when you have the 2 Zoom cameras to see the things that you wouldn't like to see if you were the patient. For example, when you are engaging with a patient, it's important to look straight at the camera, not at the bottom of the screen, because the patients can pick that up very quickly. It's important to let our patients know what we're doing. If we are typing, for example, I usually tell them, listen, I'm going to be typing, you might hear me hitting the keys of the board. If I'm reviewing at the same time that I'm seeing the patient the test, we need to let them know. You're going to see my eyesight wandering. I'm just going over different charts, different aspects of your chart. And I think that the most important thing also is that we have to become really very aware now that our body language, our expressions, they really get accentuated on the camera. If you guys can see me now, if I'm looking at the camera now, as I am, I'm looking straight into your eyes, I'm engaging with you. If someone were to come into this room now and I roll my eyes, I look to the side, if I get distracted, it really shows in the camera. So it's very important for us that we recognize that the body language is actually very important. I'm not going to mention what we have discussed in prior courses about the office setting, but now my space here that you guys are seeing where the virtual learner is showing if they're joining us from home, this becomes the office. So when I have them joining from home, I usually tell them, make sure that you're in a place that looks professional, having the microwave, the bed, a religious image, is not good in the context of seeing a patient. Make sure that you have good lighting, make sure that you have good equipment, that you have good earphones, and that you can actually be in a place where we can avoid any of the distractions. And I usually tell them, if you're at home, just maximize your platform capacity, use the backdrops, use anything that you can to make it more professional. So I'm going to really be focusing on an encounter just, go into the physical exam. And there are three important things for the residents to know that we have to pass on to them, that as they start, they should introduce themselves. They should let the patient know what their role is and what is the objective of that encounter or of that physical exam. For example, at the bariatric clinic, when I do my pre-ops, I tell the patients, I'm Dr. Tivoni, we're gonna go over your medical history, we're gonna talk about the surgeries, and we'll give you time at the end to go over some questions. Very important to ask our learners to confirm the patient's identity. My experience is that a lot of people log in through different devices that are not theirs, so always important to confirm if the patient that you are seeing is, if the device that is showing a name is the patient that you are supposed to see. Never assume that the patient that you are seeing is the one that actually has it's the name that you see in the camera. And I think it's very important that before we do any type of physical examination of encounter, that we ask the patients if they consent for this, the use of virtual medicine. We are very aware now of the Zoom bombing. We're very aware now of, the conflicts and the confidentiality issues. So it's important to ask the permission of the patient, especially if you're going to be asking them to show you a part of their body, whatever is the belly or whatever is the shoulder, so it's important to ask for permission. So for any type of system organ examination, I think I usually tell the learners this, and the minute that the camera is on, that's the moment that you actually start your virtual physical exam. As I'm introducing myself, as I'm telling the patient what is the plan for this encounter, I'm looking at the patient, I'm having a sense of the general appearance, if the patient is well looking, if it's ill looking, if they look pale, if they look, they have a yellow tinge of the skin, if they're looking diaphoretic, if they are having trouble talking, if they're looking disheveled, if they are not, in a good environment, what their nourishment is. So as we start, as the Zoom camera is on, that's when the physical exam, the observations actually starts. And I'm not shy at all asking the patients to position themselves better. I have to ask many times the patients, listen, can you go back a little bit so I can see the upper part of your chest? You don't want the patient showing you only their face. So be very comfortable asking the patients to find a position where you can do, your physical exam. And when we go into the abdominal, the neurological exam, I'll talk more about, a bit of positioning. And I think that the big difference with these virtual physical exams is that we are engaging the patient as a partner. When we have them in the office, we get them in, we sit them in the chair as we are typing maybe things in the electronic system, and we go to listen to the patient. But this is very different because you really want the patient to be your partner, and you have to engage them more. For example, when you're going to be we're going to be doing the abdominal exam, can you be in my hands? Can you palpate? Can you take your temperature? Can you do this for me? Can you show me? Can you bring bring your chin up. There's a lot of things that we can actually ask the patient so that the physical exam, it's better for us. So most definitely one of the difference with the regular physical exam that is that the patients definitely need to be more engaged. So always the question is, how do we do a proper cardiopulmonary exam virtual? And I'm really going to focus today on having the patient on camera, because it's very difficult to do a physical exam on the phone, although you could still definitely get very good clues, right? And again, if for example I'm going to see a patient in the office because they have a respiratory condition, or there's a concern about heart failure or a cardiac problem, always when we start by looking at the general appearance of the patient, are they well looking, are they breathing normally, what is the speech quality, can they speak in full sentences? And this is when, we always are very keen on getting our vital signs. And I usually say, listen, these days it's very easy to teach a patient. They might have devices. It's easy to coach them on how can they get their heart rate, how to palpate their pulse. It's very easy to tell the patients, come closer to the camera. I'm going to be staring at your chest for a few minutes. I'm checking your respiratory rate. Hold on for me. And if they have a thermometer or a blood pressure cuff, we can actually ask them to get those measurements for us. There are a lot of patients these days, we shouldn't underestimate them, that actually have pulse oximetries at home. Important questions for the patients is, for example, if you're focusing on a cardiac problem, have they noticed increased shortness of breath? Have they have decreased exercise tolerance? Are they, when they're talking to us, do they have any cough? Can they tell us if they have had more trouble with orthopnea? The weight has changed. Have they noticed any leg swelling? And for me, over the times when I'm actually doing my physical exams in the office, many times I ask the patients, are you on an iPad? Are you on a phone? Can you bring the phone down to your legs? Or if they cannot do that because they're on a desk computer, I ask them, listen, if you push over your shin, would you make an indentation? Are your legs showing any signs of swelling? Do you have any brown patches in the skin? Do you see any discoloration? Do you have any? So there are a lot of questions that even without a camera can give you a good idea of where the patient is in terms of cardiovascular health. In regards of pulmonary conditions, asthma, frequent visits to the emergency departments or the family doctor's office, chest infections, especially now going into the fall. As the patient is talking, do you notice we can instruct our junior learners to specifically look for prolonged expiration. You can ask the patient to take a breath in and a breath out, see if they have any overt wheezing. Are they coughing as they're doing that? When they are talking, are they speaking in full sentences or broken sentences? Are they using any of their accessory muscles? And we all have to understand that any virtual physical exam, and in particularly the cardiopulmonary exam, has limitations. You won't be able to do an auscultation. You cannot do a palpation. You will only get a blood pressure reading if the patient has a device, to record the blood pressure. And the same with their weight. They must have a scale at home. And, of course, the temperature, they might actually have a thermometer. I'm going to ask all of us to be advocates of virtual medicine and telehealth. And I'm going to show you in this picture a 90-year-old gentleman, this gentleman that you see here, that through OTN, he is actually, and through a remote patient monitoring, he is followed very closely by a team in regards of his heart failure. And he has a scale at home, he has a blood pressure cuff, he has an oximeter, he has a thermometer. So we shouldn't underestimate the instruments that patients have at home, that they can make our assessment better. And we should encourage patients. We're going into the era of telemedicine, so we should encourage our patients to have, if they need it, devices that they can give doctors when they see help the physicians do their assessments. We all know about the watches, the smart watches for sports. I saw a patient at the pre-op clinic the other day, and he has an Apple watch, and he has atrial fibrillation paroxysmal, and he knows because his Apple Watch tells him when his heart rate is irregular. So definitely the patients can do much more than what we think. In regards of the abdominal exam, and unfortunately we don't have a solid science behind any of that would validate any of the things that we do virtually in terms of physical exam, but most people agree that the abdominal examination is actually the most challenging to do. And we usually need, or ideally would like to have a third person in the room, a partner, a family member, a friend. You have to very specifically ask the patient to position themselves, to lie down, make sure that they expose their belly. And again, it comes into mind asking for consent prior to them showing any parts of the body to a camera. And you have to actually ask the patient to be very active on localizing first for you where the pain or the discomfort could actually be. We shouldn't be shy asking the patients to use their phone, their tablet, to show us properly and so that we could see if there are any scars, if there are any hernias, if we can even see with the camera if there are any masses, and we can always ask the person that is in the room if they see any of those things. If the camera, for example, the image is actually not very good. Over time, I find little tricks. For example, asking the patient when they're laying down, suck your belly in, blow your belly out, or you ask the person that is just beside them, can you just shake, the couch really well or the bed very well? And this is really, for example, to elicit peritoneal sounds. And it's important when we are doing an abdominal virtual examination to coach the patients through what do they need to do. And this requires education. So we all have a different method. We all, have a system for any physical exam that we do. Make sure that you guide the patient or the bystander through how to do the light palpation and the deep palpation of the abdomen, and teach them a technique. And it would take a lot of time to go over, the abdominal exam. I hope to have, some videos coming out soon, but it's important to coach the patient very well so that they can tell us where the pain is. We should educate them about the quadrants in the abdomen that we worry about. We can ask them to do different maneuvers. Put your fingers under your rib, take a deep breath. Does that make the pain worse? So we really have to be more practical in the sense of really coaching the patient to do the things that we want them to do for us. And in terms of what are the limitations on an abdominal exam, well, we won't be able to do an auscultation. The palpation is by a third person or the patient. And what I find that it's probably the most, difficult is that when we're so used to when we do an abdominal exam, to feel the belly, look at the patient's face to see if when we push down, when we let go, do we see a facial expression of pain? And unfortunately, with the virtual physical exam, it is definitely a big challenging, because you can either ask the person that is there doing for you, but once you express what we are looking for, you might actually have, not the result that, it's what it is. Yeah, so most definitely the abdominal examination is the most challenging. The neurological exam, and there are actually videos, to do a proper neurological exam. I find that, really, I don't want to say that it's actually easy to do, but if, again, we all have a system, we all do a neurological exam covering, the multiple different steps, and mental status, it's easy to do when you have the patient on camera. If there's a person beside them, asking them the usual questions, orientation, memory recall, language, speech, so that you could definitely do very well on camera. There are definitely limitations with a cranial nerve examination. You can do almost everything except your number 1, 2, and 3. The pupillary reactions can actually be challenging, but there are a lot of, help for these things. These days the cameras are actually pretty good. If you ask the patient to come right onto the camera, if you ask them to actually shine, a light, or a third person shining a light on their pupils, you will be surprised on how much you can get. You won't get anything in terms of olfactory, but definitely you can get much more than you would actually imagine. Unfortunately, for motor power, when we're actually the neurological exam, has to be assisted by a third person, and it's one of those parts of the neurological exam that probably doesn't have, the highest yield. The same for muscle tone and muscle bulk. Really, you have to completely rely on the individual that is in the room. And gait and stance are actually, very easy if you have a good camera. You just have to ask the patient to stand up and to walk, and you can see them, as they are doing that. Cerebellar testing, it's also simple to do, and definitely it's actually of high yield. And when it comes to sensation, you really have to be very creative, because it's one of the parts of the physical exam that actually can be more challenging. I invite you all to read the paper that is actually at the bottom of the slide, the virtual physical exam in the 21st century. And it tells you a little bit about, how to go system by system, how to go organ by organ. We're not going to go into examination of the thyroid, or, very specific, MSK examination, back pain, which is so common. But these days, more and more physicians are trying to come together and trying to share their experience and what has worked for them in terms of little tricks and maneuvers that can actually help, to nail a good physical exam. The cameras are ideal, and dermatology is ideal for telehealth. Just think, that with the very good cameras that we have today, type of lesions, their location, their extension, any type of wounds, the depth, the length, if there's any erythema, discharge, eczemas, if a lesion is palpable or not, you should engage the patient and ask them to press down, push down, and they can show you. And you really need to be very active and engage the patient on asking them, make sure that I need to see the rash, I need you under a good light, I need you to do this for me. And of course, these days, I have patients sending me through email or uploading in our patient portal their pictures, and has such a tremendous role, the dermatology, virtual dermatology, that of course OTN has a great portal and a great initiative in terms of dermatologic access to dermatologic care in the province. I always tell the learners, after you've done everything, after you have done in your encounter, your history and your physical exam, make sure that you summarize the encounter to the patient, explain the limitations of what you have done. And when I do my pre-ops at the bariatric clinic, I'll tell the patients, we have gone over a virtual physical exam. It has tremendous limitations. I couldn't listen to your lungs. I couldn't take your blood pressure. I couldn't get an oximetry reading. But prior to you coming to the hospital, you're going to be seeing anesthesiologists, and they're going to be doing the part that I cannot do today. And believe it or not, preoperative assessment in the virtual world are happening. And I think that California probably is ahead of the game. And it's important for our residents, for our learners to know that they have to be very clear instructions, when they're doing virtual care. They have to let the patient know exactly what that learning is doing. I'm going to talk to my attending. This is what I'm going to be doing. If everything is okay, we're going to be sending. If my plan, it's working, we're going to be contacting your pharmacy. And important to make sure that the patient also understands very clearly what they need to do. And in the virtual world, the follow-up is as important as in the in-person assessment. So it's important that the patients have, a very good understanding on what is going to be the follow-up. Whether it's going to be just a phone call, whatever it's going to be just a quick email, everything is fine, took the antibiotics, even though everything worked great. It's important to have a very good, closure on the follow-up. And I always tell the residents the same. If in any doubt, we have to bring the patient in. There are many times where I've been doing a pre-op assessment, for example, online with a resident or a junior learner, and just, you're just not happy. The patient is sitting, you cannot see much, they're not going forward, so you can see their chest, In my case, the BMI is way too large. And if you have any questions in any situation, you just have to acknowledge that this is, a modality that has not been validated, and that when in doubt is much better to bring the patient in, to be safe than actually to be sorry. And I put at the bottom some very good resources from Stanford University. There's a lot of videos, online of physicians sharing their experience on how to do, thyroid exam, a full neurological exam, and an abdominal examination. But if anything, I'm a strong believer that virtual medicine, virtual care is here to stay. In the States, they've been doing it for over 25 years. For us, it was really COVID that was a catalytic, reaction for us to go into the virtual world. But in terms of telehealth and telemedicine, I really think that these days the sky is the limit. There's much more that we can do in a very safe way to offer care to our patients in a more really a patient care way, in the sense that we are bringing medicine to them in a time that is convenient to them in their own environment. So if anything, I'm a super fan. Still, we're going to be seeing, hopefully in the future, more people doing virtual exams and sharing with the rest of us what had they found that it really worked on their assessments. And I think that with that, I'm gonna finish my talk, and of course I will take any questions in regards of sharing my experience at the clinic, or anything that you guys might have in terms of specific virtual exams.
Thank you so much, Maria. That was absolutely fascinating addition and a great segue from Heather and Becky's talk, and also from Keena's layout of sort of the lay of the land and where we were at before the pandemic. It also makes me realize that, I think you and many others realize that this was the answer to geographically isolated patients who maybe could get into a clinic with a nurse practitioner but couldn't get to a specialist. And I'm sure now that when you have the opportunity to see a patient virtually and there's actually a trained healthcare provider there who can help with the physical exam and demonstrate that to you remotely, it must feel like a huge gift compared to just walking a patient through it on their own or with their partner at home.
Absolutely, absolutely, Jill, you're absolutely right. And I mean, it would be interesting for all of us to see how our colleagues, unfortunately for themselves, have taken this, to the limit, in the sense that, these days in the States, because of the lack of intensivists, for example, they have remote ICUs with an intensivist in a huge room, with multiple monitors, where the ICU, the remote ICU rooms have, this incredible equipment. So really, when it comes to telemedicine, I really think that the sky is the limit, and we just have to get more comfortable, because there are a lot of things that, we can definitely do that we think that they might be challenging or difficult.
And I think amazing. One of the things I was going to raise, actually, Maria, is that I like how you have explained that so much of this is new for everyone. So when you're orienting your junior learners and they're asking you questions and they're expecting you to have some user's guide in the back of your, like armamentarium, I think this is where you get to carve out to say, we might not have one of those. Maybe at some point we can have a rational clinical exam series paper on this stuff, but right now we don't have actually a lot of data on what works and what doesn't. There's some emerging data, like you pointed out, but there's not a lot of hard and fast rules. So I think it'll be interesting as this virtual physical exam field changes. But I think it's going to be just the reality that our learners will be learning alongside us.
No, absolutely, absolutely.